develop habits of mutual accountability and make public reports, and I'll return to that a little later as well. Results-based accountability, at least in this stage, it seems to me, spurs collective impact forward. And one reason is the very nature of the kind of goal, children of all races and from all income levels will be ready for school by age 5 and successful learners by age 9, cannot be achieved by any one agency. State Department of Education cannot do that alone. A school district cannot do that alone. As soon as you start thinking about collective impact, results-based accountability as a tool makes it real to you. You need partners to do this work. There's a big study on the education turnaround made in Chicago when Arnie Duncan was the district superintendent in Chicago. And about 20% of the effect in raised scores comes from parent engagement. It is much easier to get where you want to go when you have more hands on the work than when you imagine it can be left entirely to teachers' materials in the classroom. So that's my pitch for collective impact. It also invites systemic thinking, and there's a lovely short article about 6 pages long, David Peter Stroh's Systems Thinking for Foundations, it's called, and you can Google it. But it teaches me to value the whole over the parts, to look at the disease rather than symptoms. There's a very nice capsulization. There's also a separate article on it. Kind of how homelessness became an industry that no longer was solving the problem of people not having permanent residence, and how donors became part of the problem. And I won't play it all out for you. I just commend it to your attention. It's digestible. David Peter Stroh writes with incredible clarity. And it does bring you back again and again to even the sum of the competence of individual agencies will not add up to a community impact on the scale you're looking for unless you do something about the communication between them, about the common agenda, and those related elements. You might at this point be skeptical because I've just trotted in 3 fairly big concepts that are running around, and okay, what does it mean on the ground? We're providing core support to a discovery coordinator who staffs a collaborative table. Results-based accountability, most of the communities are pretty good at parent engagement or community engagement. We like to think we're good at it. But you can't go very far down the trail of trying to build a plan and a results-based accountability framework without asking yourself, who is in at this table who needs it? Do we really have a health partner in a functional way who can deliver on some things we need for young kids and that sort of thing? So when it's working on the ground, after a point in time, you do begin to see results. And speaking of mutual accountability, many of the communities issue report cards on the condition of their children. Actually, why they've been brought together is take a look at the condition of your children, figure out what needs to be done, fashion strategies to address it, and get moving. Analyze, reflect, organize, and act on behalf of kids. This is a facsimile of the 2013 community report card just issued by Danbury. They call themselves, their discovery is called the Promise for Children Partnership. And their promise, which might sound eerily familiar, is all Danbury children aged birth through age 8 are healthy and ready for school and lifelong learning. Many of these results get into cast on that. So you can Google this and find the report. Speaking of partnerships, the green arrows, there are 14 or 15 of them. And they're not individual organizations, they're categories of organizations that are playing in this. State agencies, service agencies, parents, faith-based organizations, schools, early childhood programs, businesses, plural, Western Connecticut State University, foundations, the municipality itself, Danbury Public Schools, United Way of Western Connecticut, Danbury Children First, Education Connection, the Danbury School Readiness Council. And when this is working at that level, what we find is, our lessons learned, people will rally to a population result that's relevant to them. You set out one of those big hairy goals as a population result and people come around. By June 30th this year, just a couple of months away, of the 52 discovery communities, 40 either have or will have a functioning plan and an RBA framework in place, and as they go along, we'll be prepared to look at how their strategies are playing out year to year and what's happening for the condition of children. As I said, RBA encourages them to reach out to a more and more diverse and competent constituency to carry out the planning. It emphasizes partnership and the transparency of those partnerships. It strengthens community practice and mutual accountability. Memorandum of agreement are forged among the partners with specific roles and responsibilities. And I think in the context of this room, local philanthropy tends to take these plans once in place very, very seriously and align to their priorities. Meriden, Connecticut, at 58,000 people, is the smallest municipality in the United States to receive a Promised Neighborhood grant from the federal government. It's incredibly competitive. $400,000 for planning in a relatively small place, though it has very urban problems on its own scale. The private funders in that community say, if it relates to early childhood and it's in our community blueprint, it gets funded. If it relates to early childhood and it's not in the blueprint, it doesn't get funded, because they've been through such a thorough process of analyzing what's going on. What are some of the things that people take on? A number of communities are working on childhood obesity, to their surprise. Childhood obesity tends to be a larger problem, a more prevalent problem in poor communities and communities of color than in the nation as a whole. But a number of communities, including Britain, Connecticut, have been really struck by how high, even above the norms for, say, communities of color or poor communities, they're having a level of incidence that really creates a public health crisis. If kids have that kind of health problem, they're going to have some related health struggles, and they may be absent more, and it may compromise their schooling. So that's their thinking on that. At the state level, we try to make offers to the state that they can't refuse that align with the discovery work. For instance, the community grant that propels BAKE forward includes money from us, money from the state, and money from the Child Health and Development Institute of the Children's Fund of Connecticut. And in some cases, within 5 communities, an early literacy grant from Annie E. Casey Foundation, as people have found discovery a better and better platform on which to kind of move some of these issues. So we are in partnership with the state government on those community grants, the planning and action implementation, and with them on the Parent Trust Fund. Parent leadership development is a real driver of these things, and I won't go into all of the granular things that can be said about Danbury, but basically they've got a cadre of trained parents, as you do through BAKE, who've been taking advantage of really some lighthouse programs in the nation on parent leadership development in the state of Connecticut. Parent Leadership Training Institute, People Empowering People, and as a result, they've got cohorts of folks who will see a particular problem. Maybe it involves parks and recreation, and not say the other guy's the problem. They'll say, what can we do? What part of this do we own? And if it needs surveys, if it needs volunteer work, they get it done. I've mentioned early literacy, and in total, we're putting about $3.1 million forward to the state. We'll propose that this year. We anticipate $750,000 from other philanthropic sources. We're looking for $2.5 million from the state, a total of $6.3 million to sustain the work in communities, to build parent leadership, to help with early literacy, and to look at kids' health in conjunction with all of these things. My board has an extraordinary ability to see the big picture and really step up to it. And as you may know, there is proposed a new Office of Early Childhood. If it happens, as it's currently proposed in the legislature, it will combine 90 people and $300 million from 5 state agencies across 16 programs into one office, and finally begin the process of aligning what we do in early childhood across those boundaries, making it easier, we hope, over time for families and communities to access the help they need and not get caught in a whipsaw between policy differences in the way funds are allocated, say between historically DSS and SDE. Not to pick on anyone, but those are the 2 big programs. Mm-hmm. So we would very much at the Memorial Fund like to be part of helping this thing give birth. The trustees agreed to put up $1 million over 2 years to speed the plow on this. What it would do, it's going to be a very tall order from an operations planning point of view to blend people from 5 different organizational cultures, to say nothing of the technical stuff about human resources, benefits, and all of that. A full, rich life, plus which it's been proposed that there be an early childhood institute. And with that, I return to the subject of backbone organization. The Memorial Fund, I think through its capacity building as much as its grant making, has been acting as the backbone for this drive towards improved and more accessible and more available early childhood. At some point, we need to get out of the middle and just be part of a larger network. We don't propose to go away on this, but we think a public-private early childhood institute at the state level might be a great way to go. United Ways have played a very special role that I want to call on. When we fund locally, we asked that the mayor, the superintendent of schools, a parent leader, the chair of the legally mandated School Readiness Council, and a not-for-profit that knows how to receive and manage grants sign off on the proposal for Discovery. We do not dictate to community who that collaborative sponsor is. We ask them to choose. The plurality choice is United Ways. There are 17 communities that have a United Way and some governance role, and 14 communities spread across 11 United Ways. The United Way is the collaborative sponsor. Making no judgment about this, but just as an observation, there are 3 community foundations and several of the RESCs, or Regional Education Service organizations, are on the docket as Discovery Collaborative sponsors, and then it breaks down to multi-service centers and the like. A 20/20 hindsight for me was, if I knew today what I knew then, or if I'd known then what I know today, I think we would have specified that it be either a United Way or a community foundation. You folks have the connections in the philanthropic community to help things align, to leverage other resources, to keep the focus slightly over the horizon and say year to year, what's the condition of our kids? How well are we moving? How many are we serving? Is anyone better off? All of those results-based accountability questions. So with that, I'll give my voice a rest unless you have questions.
What are the 5 agencies that you're bringing together?
At the state level?
Yeah.
Oh boy, from memory. The Care for Kids program from Department of Social Services, School Readiness and other programs from State Department of Education, the Birth to 3 programs from Department of DDR, DDS, Department of Developmental Services, Connecticut Charts of course from the Board of Regents, and on a list of 5, I'll forget one. I'm looking to...
EPH.
You're the greatest, that's right, the licensing and inspection from Department of Public Health. And now we know why collective impact works. Especially above the age of 50. My wife and I have determined that divorce is no longer feasible beyond the age of 50 because who will supply actors' last names when you're trying to think of a movie? So but it's 16 programs. It's an enormous piece of work. There's a new housing department consolidation going on. It seems like it draws fewer questions, even though many more zeros on the budget. But as someone said, that's going to be a piece of cake compared to the complexities of blending the 5 different organizational cultures at the new office of Village Health. Sam?
Results-based accountability.
Yep.
Every community has their own way of gathering information.
Mm-hmm.
How do we tackle this issue? I think our donors want that. We've got to be able to show them what we're doing with their contributions back.
I feel like Bill Mazeroski.
Yeah.
The big one's coming over the plate. It's a great question. One of the things that I really like the people I get to work with in our community program